Good morning, afternoon, everyone. Today we'll be discussing an emerging topic in spinal rehabilitation. The neuroplastic spine specifically will explore how pain, posture, and perception are interlinked in chronic spinal conditions. Neuroplasticity refers to the brain's ability to adapt and reorganize its structure and function in response to experiences, injury, or disease. In the case of chronic pain, neuroplastic changes are not just limited to the injured tissue, but extend to brain areas responsible for pain perception, motor control, and sensory processing. Research has shown that in chronic pain conditions, areas of the brain like the somatosensory cortex can undergo significant reorganization. We will delve into how these changes influence chronic spinal pain. The goal of this presentation is to understand the neuroplastic changes that occur in chronic spinal pain. We'll examine the central nervous system's role and how it adapts in response to chronic pain. Additionally, I'll share strategies on how we can implement neuroplasticity-based approaches into clinical practice, including the integration of multidisciplinary strategies for more effective treatment. By the end of this talk, you should have a clearer picture of how neuroplasticity can guide rehabilitation. Neuroplastic changes in chronic pain. Chronic pain is associated with several neuroplastic changes, such as the reorganization of the somatosensory cortex, which processes touch and pain sensations. The motor cortex can also experience inhibition, leading to impaired motor control. This dysfunction can make movements difficult and painful. Additionally, glial cell activation and neuroinflammation further exacerbate the pain experience. These changes help explain why chronic pain persists even in the absence of tissue damage. Pain, posture, and perception interaction. One of the most interesting aspects of chronic pain is how it interacts with posture and perception. Poor posture can exacerbate pain, and in turn, pain can distort how we perceive and adjust our posture. This creates a feedback loop where each factor perpetuates the others. Moreover, chronic pain often alters the body schema, which is the brain's representation of the body's position in space. Psychosocial factors such as pain-related fear and avoidance behaviors also contribute to this cycle. Clinical intervention strategies. So, how do we intervene clinically? There are several effective strategies for addressing neuroplastic changes in chronic spinal pain. Exercise is paramount, particularly exercises that focus on sensory motor control and proprioception. These exercises can help retrain the brain and body's communication and coordination. Neuromodulation techniques such as repetitive transcranial magnetic stimulation, RTMS, and transcranial direct current stimulation, TDCS, have shown promise in reducing chronic pain by modulating brain activity. Another crucial strategy is pain neuroscience education, PNE, which educates patients about the neurobiological underpinnings of pain to reduce fear and enhance their ability to cope with pain. Case study. Let's look at a real-life example to bring these concepts together. We have a 35-year-old patient with chronic low back pain and postural dysfunction. The treatment plan involved neuroplastic-focused exercises, PNE, and breathing exercises to reduce fear avoidance behaviors. After several weeks, we observed a significant reduction in visual analog scale, VAS, scores, improved posture, and better functional movement. This case exemplifies how neuroplasticity-based interventions can lead to meaningful outcomes. Future perspective and clinical recommendations. As we look to the future, neuroplasticity should be a central focus in the rehabilitation of chronic spinal conditions. Clinicians should target not only the spine, but also the brain in treatment. A multidisciplinary approach is key, incorporating exercise, education, and advanced technologies. The next step is to incorporate brain-targeted interventions more routinely in clinical practice. It's time we expand our understanding of spinal pain to include these neuroplastic mechanisms. References. Finally, here is a list of the references used in preparing this presentation. These articles and books provide a deeper dive into the topics we've covered today and can be excellent resources for further reading.